Let's talk about signs of abuse or neglect. Now, NCLEX test this, right? Very important, because one thing about this topic is that we need to report this anytime we suspect what abuse or neglect. That is the main reason why NCLEX want us to know the signs, so that when they present a particular sign that look like what abuse or neglect, we know we what need to report it, because this is part of what mandatory what report, right? Mandatory report, very important for the NCLEX exam, right? The moment you suspect it, you need to report. Now, over here we have type of abuse. We have physical abuse, sexual abuse, emotional abuse, neglect, financial abuse. Right. Know this, very important. Physical, emotional, sexual, neglect, and financial abuse. Right. Now, so that once you see it on the NCLEX exam, you can identify, oh, this is a physical abuse, this is a sexual abuse, this is a emotional abuse, neglect, financial abuse. Very important. Now, these are the red flags you are going to see the NCLEX giving you. Right. The NCLEX can either say injury in multiple stages of healing, then you know, oh, that is what abuse. Or the NCLEX can say stories that don't match the injury, that is a sign of abuse. Or the client is fearful, withdrawn, or overly compliant behavior, sign of abuse. Now, if it's neglect, right here we are talking about poor hygiene, malnutrition, untreated medical issues. This is your neglect right here. Right, caregiver refuses to leave or speak for the client, sign of what abuse. All these things you need to see them. You will see one of the NCLEX definitely going to use one of them. Now look at this: bruises on soft area. Now, one thing you need to know is that you can have bruises um on bony area, right? So, but the NCLEX for abuse and neglect, NCLEX wants you to focus on what? Soft area, not bony area. Right. So if you see anything related to bony area, then that is no abuse. Now look at this. Let me show you a certain example. Now if you look at this example right here, right? If you look at option 3, it's talking about possible what? Child abuse. Now this is the main reason why NCLEX wants you to know sign of abuse. Now, because now the patient is having issues like irregular area of dark blue pigmentation, but look at where they're having it, their sacral area, and that is what a bony area. So this is not a sign of abuse, because NCLEX wants you to identify only what? Bruises on soft area, which is the back, the thigh, the genitals. Right, that's what NCLEX wants you to identify. For adult, right, pressure ulcer, right, that can be your neglect right there, dehydration, over sedation, right, sudden money losses, right, that's financial abuse. Now, genital injury or fear around caregiver, very common. They fear to speak around caregiver, right? This is very common. They have the fear to speak around caregiver. Now, what should you do as the nurse? So, as the nurse, right, you are mandatory to report this, right, by law. So, it's something you need to report. You don't keep this confidential. The family member might be saying, please, we want you to keep this confidential, private. You have to tell the family member no, because by law, you need to what? Report it. Right. It's not something we protect. Right. Also, you want to document, right, what you see and hear objectively, not subjectively. Right. You want to ensure safety, the client safety, remove the client if needed, right, from where the abuser is. Right. Now, never, look at this one, it's very important, never confront the abuser or delay action. The action is to report. Don't never delay the action. Now, if your question involve what? Suspected abuse, the correct answer is usually involve what? To report, ensure safety, and what? Document. You don't need proof before you report abuse or neglect. Just suspecting it is enough. Right. All right. So now let us answer this question together. Now, so the nurse is assessing a 3-year-old brought by the caregiver for a fall for a fall down the stairs. Okay, for a fall down the stairs. Now, the child has bruises on the back and thigh, right? Because one thing about a fall down the stairs is that at least we should see, for a fall down the stairs, at least we should see like bony area injury. But back, thigh only is not really, you know, saying um it's not really telling us if they truly fall down the stairs. You understand what I'm trying to say? Right. It's not really telling us that. So back tie is related to what? Abuse. So NCLEX is just trying to like make you relate that this information and this, they are not matching each other. Now the caregiver avoid question. That is one red flag, and insists that the child is what? Clumsy. What is the nurse best action? So this way we already what? Suspect what? Abuse. Now the next thing we need to do is to do B, which is to notify the child um protective service immediately. That is what we need to do. Right. So that's the first thing we definitely need to do. Now if you look at this particular question, the reason why I put up this particular question is that when you see this particular question, you might think it's abuse. Right. Because obviously one of the option have what? um you to report finding to the registered nurse as what? Evidence of possible child abuse. But the reason why this is not child abuse is that we don't with the what the nurse is observing is on bony area. So this is not related to child abuse. Right. This is just related to maybe um o- uh, uh, let me say ethnic thing, or maybe the condition, right? So it's just related to something like that. But right here you can see it's ethnic background. You understand? Because as a nurse, that's what you'll be thinking about. Since it's not related to abuse, maybe it's the condition or what? Ethnic background, right? So but if you look at your answer key, you definitely see ethnic background right there, and then number one is definitely your answer. Now look at this particular question. They said the nurse has attended a staff education program about elder abuse. Now, which of the following statement by the nurse would indicate a correct understanding of the teaching? So far so good. I'm giving you clear understanding of abuse. So now let us see how you relate with that. Now, the healthcare worker or family member who threatens to withhold food, water, and medical care is committing a form of abuse. Remember we said that, right? Causing, if you threaten to withhold food, water, medical care, guess what? See what is going to happen. Now see what is going to happen when you do that. Right. What will happen? There will be poor hygiene, malnutrition, and then what? Medical care. Then there will be untreated medical issues. Right. So obviously that is a typical sign of what? Abuse. Now the nurse should explain to the victim of elder abuse that data collected about the abuse will be kept confidential. Remember, we don't keep it confidential. As I said previously, we report it. So this is definitely wrong. Right. Clients who are physically disabled and living in a long-term care facility are the typical victim of elder abuse. No, this is very biased to say it's only this set of people that are typical victim of abuse. We have a lot of people that experience abuse, so this is biased. NCLEX don't support that, so that is out. Now older adults who abuse will readily explain their situation to a health care provider if asked directly. Definitely they will not be readily to explain because of what? Fear of the abuser. So they are not definitely going to be able to explain. So your answer is what? One. So this is everything you need to know about what? sign of abuse for the NCLEX exam. So all you just need to just know is to be able to identify sign of abuse, and this is all you just need to be able to identify sign of abuse. The moment you can be able to know all these things, trust me, you are good to go in answering abuse question on the NCLEX exam. The most important thing is knowing the sign and your next action. Your next action is always to what? Report. You report before documenting. Right, you report before documenting. If it's a select or apply, then you can select, report, document, and then ensure safety. Right, you can see it right there. Report, ensure safety, document. Okay, document is even the last thing. You want to ensure safety, right, before document. Just follow this order: report, ensure safety, document. Right, but if you say select or apply, then every of those three would definitely be the correct answer. So I'm going to see you in my next video.